evening, everyone, and thank you for joining us. My name is Rebecca Shruti, Director of Alumni Relations here at Jefferson. And again, I wanted to thank you for joining us and welcome to our Telehealth, the future of medical care delivery. So we just have a few introduction slides before we get started with the presentation. So just some notes for this evening. If you are joining us by telephone, please make sure to mute your phones and feel free to submit questions throughout the presentation by using the question box on the right. Tonight we have more than 140 alumni from 22 states joining us. So as you can see there on the map, a breakdown of all the alumni that are with us tonight. Very glad a lot of people came from all over to watch us for this webinar this evening. Oh, I just got a comment that my audio is going in and out. Sorry about that. Try this and see if that's a little better. All right. Our speaker this evening is Dr. Shruti Chandra, class of 2012. She's the Program Director of the Telehealth Certificate, Associate Director, and Faculty for the Department of Emergency Medicine. If you'd like to learn more about Jefferson's telehealth services and programs, please visit either of these websites. And again, the webinar is being recorded, so we will send this out to everyone who participated this evening, so you don't have to worry about jotting this down right now. We do over 65 alumni events throughout the year. So here you can see our upcoming alumni events. We're actually focused a little bit in California for the summer. So you'll see we'll be in Laguna Beach, Los Angeles, San Diego, and San Francisco. And of course, for everyone who's SKMC alumni, please save the date for October 27th through the 28th for Alumni Weekend. We are planning for fall, so please let us know any ideas you may have, or if you're willing to volunteer as a speaker. And that's it for me, and now I'd like to turn everything over to our presenter.
Thank you so much. Give me a second, let me see if I can actually share my screen.
Here, I just gave you control for being a presenter, so that should work now, Dr. Chandra.
Perfect. How's that? Does that work?
Yep, we are seeing your screen. Thank you.
All right, great. So good evening, everybody. Thank you for the opportunity to let me speak with you. My name is Shruti Chandra, and not only did I graduate medical school at Jefferson, I completed my emergency medicine residency at Jefferson. I did a medical education fellowship, and now I am practicing primarily as an ER physician and assistant professor at Jefferson and Methodist hospitals. But on top of that, I have a few other roles in the education world. I am the associate director for the emergency medicine education and curricula, and I'm also the associate clerkship director for the undergraduate medical education clerkship for emergency medicine. But today we're going to talk about telehealth. So how did I get involved in telehealth? It was through my role as education. So when I was in education fellowship, I got involved in the curriculum development for the Telehealth Certificate Facilitator program. My interest lay more in instructional strategies more than in telehealth itself, but as I began to explore the scope and the implications that telehealth can have, not only in emergency medicine, but in all medical fields, I became quite fascinated. And now I'm a practicing telehealth physician. I'm the program director of the same certificate program that I started with, And I'm also involved in program development for other telehealth courses, as well as in clinical research within telehealth. So let's start with a little bit of a background. What is telehealth? Simply put, telehealth connects healthcare providers and consumers via electronic communications. However, the applications of telehealth are way more than that and almost endless. Telehealth is revolutionizing healthcare and its delivery by connecting patients and providers quickly, efficiently, and at low costs. The Institute for Healthcare Improvement, which is the IHI, set out a triple aim to optimize health system performances, and these include improving patient experience, including quality and satisfaction of the care, improving the health of populations, and reducing costs. Telehealth has fulfilled all three of these aims. It improves access to care, it increases efficiency and reduces costs, and it enhances patient outcomes. Now, telehealth can be delivered in multiple ways, and I'm going to give you a small summary so you understand the scope of how much telehealth can actually do. Synchronous delivery is a kind of delivery that requires real-time face-to-face contact, and these are the ones that people are most familiar with. So these are virtual visits, these are consults, these are people meeting face-to-face with their providers. Asynchronous delivery involves store and forward technology. So this is, for example, sending an X-ray to a radiologist for them to read at a different time, or a photograph of a rash to a dermatologist for them to take a look and diagnose for you. Remote monitoring collects data from one location and then transmits it to a provider in a different location. This could be like remote ICU monitoring, where one provider sits at a remote location and monitors multiple ICUs, their vital signs, the patients, and then is able to make decisions based on this. Another option is home dialysis monitoring. So for patients who live at home and have dialysis at home and not able to travel, their vital signs and dialysis can be monitored from a remote location. And lastly, there's mobile health, which is sort of a growing field, and it's about gathering and then transmitting health information through a mobile device. This could be a phone, this could be an iPad, and this can include a milieu of things. We can send automated hospital discharges to patients. We can monitor chronic diseases like diabetes or hypertension. We can help with addiction management and depression management. And this is just a snapshot of everything that telehealth can do. So Jefferson has recognized its significance and has incorporated telehealth in almost all practices and specialties. This includes, as you can see the list, neurology, surgery, OB, psychiatry, internal medicine, research, and of course, emergency medicine. Surgery, OB, and internal medicine are doing scheduled visits with their patients, and residents are involved in this as well. Radiation oncology is trying to switch out all their post-op visits to telehealth and is in fact conducting a research trial on efficacy of these visits at this time. We can also use store and forward technology to allow for wound care and other post-op visits for teleconsults. Application in research for telehealth as well. For example, research subjects can use telehealth for their weekly check-ins or for pill counts with the patients without having to travel and come in for their research drugs. Now within emergency medicine, which is what I have most experience with, we have set up a system of on-demand visits through Jeff Connect, which is our online app, to provide access to care whenever and wherever patients need it. And this is the synchronous modality of telehealth. So basically a patient can get on this app, can call in for whatever problem they may have from the comfort of their home, or don't have to leave work, and get whatever physician that they see and get all the advice that they could without having to come in. This is the aspect of telehealth in which I work, so if you ever call into Jeff Connect, you may actually see me as your doctor. The Jefferson Expert Teleconsulting System, which is JET, is used by the Neuroscience Hospital, and it is the oldest and the first use of telehealth at Jefferson. It is also the first in the region to provide robotic teleconsulting and facilitate timely stroke treatment, as well as transfers if needed. In fact, recently, during the public transportation SEPTA strike in Philadelphia, patients found a special need for telehealth in Jeff Connect when they could not reach their doctors and they could not see their appointments or they could not come to the ER for acute care visits. Jeff Connect also had a very high demand during the Pope visit to Philadelphia, when no one could actually reach the hospital because it was cordoned off. And this is just an example of telehealth use in an especially busy time. Everyone is now recognizing that telehealth will become useful even in day-to-day healthcare delivery. So I'm going to pause here just as I always do and ask for questions, and please go ahead and add them in as you do, and I'll answer them as we go along. All right. So as we move on, telehealth and education. So this is my realm, and this is what I do. And as telehealth expands and it's adopted by more and more hospitals, offices, healthcare facilities, there's an emerging need for trained professionals who will effectively and efficiently deliver telehealth services. No telehealth program at Jefferson or anywhere else can be sustainable without trained individuals with formal education. Currently, there are very few programs and trained individuals within the field of telehealth. Many persons who are practicing telehealth right now or supporting programs have learned from experience. However, in my opinion, has the potential to open up many more avenues and opportunities and has the potential to streamline and enhance the performance of any telehealth program. So, in my opinion, there are at least 4 paths that one can take as a telehealth trained individual. You could be a facilitator or coordinator. This individual can facilitate telehealth conversations between patients and providers. They manage the interface, they can deal with technical challenges, and they ensure a successful call legally, culturally sensitive, technically, and complete the whole experience for the patient and the provider. You can also be an educator, and this can be twofold. One is patient education. For example, you can have medication education, wound or ostomy care, or follow-up care to prevent 30-day readmission rates. The second realm is to be a telehealth educator. This is the role that I've taken, and my role is to educate those who are going to be going into telehealth. Your third could be as a program developer or an innovator, really. If you can suggest new and innovative ways to address today's healthcare issues and help develop, run telehealth programs to address these issues, that really is important in the realm of patient safety and quality improvement. And lastly, you can be a provider in telehealth. And as a provider, you could take care of your patients as doctors or advanced practitioners or even therapists. So I strongly believe that individuals who are knowledgeable about telehealth can serve as leaders who are proficient in applying telehealth to patient care and can lead the way in innovation in the field. And by adding telehealth as a skill set in their toolbox, any of you can have the ability to practice, create, and support telehealth and support telehealth-related programs. However, as we mentioned, training programs are in response to this need. Jefferson has created multiple telehealth educational programs, and I'm just going to talk to you about a few of these. So the Telehealth Facilitator program is the one that I've been most directly involved in the curriculum development and currently as the program director as we are running it. It is one of the first such programs that Jefferson has created and that has been created throughout the country. This program is basically for anybody who is in the world of medicine, doctors, nurses, allied professionals, pharmacy, even secretaries, anybody who wants to obtain and implement their telehealth skills in any program that they're given. So as mentioned previously, a facilitator or coordinator can tackle multiple aspects of the telehealth experience. They connect the patient and the provider, they manage the interface, they address technical challenges, and they ensure an ethically and legally sound visit. By the end of this program, you can be an expert in telehealth and its delivery modalities and understand and be able to perform the role of a facilitator. The course is 5 weeks, it's self-directed, it's completely online and asynchronous, which makes sense because this is a telehealth program. This means that you can learn in a self-directed manner at your own pace. You have enough time to explore and internalize all the concepts that are presented. It's also ATA accredited, which is the American Telemedicine Association, which is the only association that's providing accreditation to educational programs. And this is one of the only ones that is providing this. The course also gives CME, CNE, and pharmacy credits. So if anyone's interested, please go to the website that's listed here. It's jefferson.edu/telehealth. And the summer cohort is currently in process, and the fall will start in September. There are also multiple other educational opportunities that we've been working on at Jefferson. There's a one-year Telehealth Leadership Fellowship that aims to develop leadership skills and entrepreneurship skills with a special focus on research and scholarship. It also allows for clinical experiences in telehealth delivery. So as a fellow, you do telehealth shifts, and you also get involved in telehealth research, specifically some of the clinical research trials that we've been conducting about the comparison of telehealth care versus in-person, face-to-face care. We're also continuing to expand the Telehealth Certificate Program and creating an advanced certificate program to create a one-on-one experience through shadowing and mentorship. This should be starting in the fall as well. And this program will allow the learners to better understand the day-to-day running of the telehealth program. For graduate medical education and mid-level providers, we have patient callback and follow-up programs through telehealth and have training and education sessions to prepare for these calls. This system is aimed to improve patient satisfaction, medication compliance, readmission rates, and help with close outpatient follow-up. We have a PACU Ambassadors program. Its goal is to connect patients with their family members through telehealth while they're recovering from surgery or procedures in the PACU. So currently, when patients are done with their surgery and they come into the PACU, they are unable to see their family. So this program helps them connect through telehealth, and this is a 3-month-long program and involves live calls as well as training. We're also incorporating telehealth in a variety of residencies. For example, psychiatry residents need to talk to their attendings before they commit a patient involuntarily. The attending is usually not in-house, so they have to wait, and the wait can be very, very long. Through telehealth, the attending can speak with the patient live and decide if involuntary commitment is the right way to go. We have also created a month-long rotation for medical students and PA students who are interested in telehealth to get more experience in the different aspects of telehealth delivery. And these are just a few programs that I have been directly involved in. There are, I am sure, a multitude that are being developed even now as we speak. Before we move on, there is a question which I am trying to open. The question is, I've heard that some states, in order to see a patient via telehealth video or audio, that the patient must be an established patient. Is this not the case in PA? I would assume that this is why people are able to be seen via Jeff Connect. All right, so it's a long question, so let me answer that part first. So there are some patients that do require you to be established patients. So for people who are internal medicine or family medicine patients, currently the rule is that you need to be an established patient. But that's not because it's because of telehealth, but it's because the way that reimbursement works. For us, as emergency medicine physicians, we can see anybody calling in from anywhere, and they don't have to be established patients because we're emergency medicine. We don't have any established patients. And in fact, Medicare and Medicaid are currently paying for these as acute care visits. The next question is, are there any limitations or increased liabilities to see patients or such an exam being performed? So that's a great question. We talked about that a very long time to see how well can we really see these patients and how well can you perform an exam. And we realized that there's actually a lot of parts of the exam that we can perform. So most specialties are using telehealth for visits that don't necessarily require exams. For example, post-op visits where they can just visually inspect the wound, or for planning visits for radiation oncology, or for OB and doing family planning visits, or for psychiatry where they don't have to do an exam. In ER, where I work, where we're seeing patients with these chief complaints, you'll be surprised how much you can do just on video. So you can do a full neurological exam by asking the patient to perform certain functions. You can do an oropharynx HENT exam just by getting them to open their mouth and take a look with their camera. You can do a visual inspection of their skin for rashes. So most of these complaints end up being sort of urgent care complaints, and this way we can actually treat them and take care of them as we do. If for any reason we're not comfortable to take care of them, we will usually refer them to the ER or to their primary care physician. This way we also cover our liability, and we have whatever malpractice insurance that usually covers us. All right, there's one more question. What's the role of a nurse practitioner in using telehealth? That's a great question. So I think I'm going to go back to the same slide that I talked about. As a nurse practitioner, you could do the same 4 things that you talked about. You can be a provider, you can be an educator, you could be a coordinator, and you can be a program developer in telehealth as well. So a lot of our nurse practitioners currently will call that telehealth to follow up with patients. If you are a primary provider under the helm of a physician, you can do telehealth calls while the physician's around or in the room, and they don't actually have to be there. I mean, nurse practitioners are independent practitioners, so they can practice in telehealth without any problems. All right, so I'm going to move on and complete some of my slides and then open up to a few more questions. So as we talked about it, there's a lot of educational experiences in telehealth, but I would be remiss if I did not talk about the applications of telehealth and its innovation and its innovative use in the world of education itself. I'm an educator, and I'm always trying to look for interesting ways and interesting experiences to use for educational materials. And there are multiple applications of telehealth within graduate, postgraduate, and certificate education, such as the use of on-demand, online computational models for simulation. You can use artificial intelligence where there's real patients cannot be used. It's very important for telerobotic surgery for practitioners to practice. Telehealth also has an increasing role in research and research training, giving access to more expensive technologies and machines remotely. And most importantly, telehealth can connect experts in the fields of education and research in a more meaningful way, thereby allowing for remote collaborations. So I encourage you all, no matter what your role is within the institution, to consider learning about telehealth and doing some formal education within the realm of telehealth. It'll just position you to be a better practitioner or better caregiver, give more options to your patients, and this can make you a leader and an innovator in the field of telehealth. So the power of education for me is what leads to success and change and reform. So I hope that everybody gets involved, and please ask me any more questions, and I'm available on my email. So go ahead, and I will see if I can answer more questions now. All right, so any other questions that I can answer? And if I don't see them, could you just tell me if you're seeing them in your question box?
Sorry, yeah, let's see here. Yeah, a few came up. Let's see here. I just want to go past the ones that we answered. Do you record your visits and save them?
So we don't. There are a couple places that we can. For HIPAA reasons, we don't actually record our visits, but we do have transcripts for our visits. There are some other platforms that do have the ability to record. We've looked into recording for educational purposes. For example, when our residents are doing telehealth visits, we could record them and then give them feedback later. For currently, we personally do not record our visits.
Okay, great. Dr. Larry Glazeman, class of 76, did mention that he applied to the Telehealth Facilitator program, and he's looking forward to the fall.
That's perfect. Welcome.
Yeah, wonderful. Someone did ask if they will be getting a certificate for participating. Just want to say that we will not be offering a certificate, and this is just an alumni online program. Let's see. Do you know if the Allied Health College is teaching this for students in the PT and OT program, so the College of Health Professions?
Sure. So actually, currently, I'm not sure if they are, but we're looking into opening up telehealth programs for PT and OT. I do know that in the previous telehealth certificate programs, there have been PT, OT, and rehab students who have been involved in the certificate. So I don't know if actively there are any programs, but we're definitely looking to expand through the PT, OT, and PA programs. There's a lot of applications for rehab medicine and OT medicine, and in fact, there's a lot of literature in those realms, so I would not be surprised that this is going to happen pretty soon.
Great. Someone asked, can you explain how billing works for providers doing telehealth visits?
I can most certainly try. I am not the expert, and in fact, billing evades me a lot because I am ER, so I don't have to bill. I just take everybody, and I see them. The way that it works for so the short answer is this. It's different for different types of visits, and it's different in each state, and it's different based on what insurance is covering. Medicare and Medicaid are covering different levels of visits in different states, and you can look that up. And some private insurances have also started covering telehealth visits. What I do know is that in on-demand visit at Jefferson, which is to see an ER doctor, is out of pocket $50, but most of it gets covered by Medicare and Medicaid.
Let's see, is there a certificate program to train physicians in being telehealth providers, not facilitators, or is this included in the facilitator program?
So a lot of the training that we're doing, a lot of the information that's in the Telehealth Facilitator program actually involves and includes the things that a physician might need. The specific training that a physician requires to be a provider is actually more of the technical aspects of things. We're not teaching how to be a doctor because we already know that, or a nurse practitioner or a provider in that sense. So you get a lot of the information that you need to be a successful and knowledgeable provider through the certificate program. Again, it's not directly aimed towards physicians, but it is aimed towards anyone trying to do telehealth because it gives you all the information that you need. You know, what is telehealth? What kind of delivery models do you use? What are the applications? What is the billing and the law surrounding it? What's the technical aspects of it? Kind of what you would need to be a provider.
Great. Someone asked, I work in critical care. If I were to be a telehealth provider and recommend a procedure to be performed remotely by someone else, such as a central line or intubation, what is my responsibility and liability to the outcome?
Oh, that's a good question. The answer is I don't know because not a lot of people know yet. There are different liabilities based on where you work, and for example, the remote ICU physicians, they have different sort of contracts with the ICUs that they work with, so that if they do recommend a procedure, then the person performing the procedure will share the liability or take the liability. So I would, if you're interested in doing that, I would look into what the policies are in the remote ICUs that you're trying to work at.
Great. So someone asked, does the Facilitator Certificate program provide simulation resources?
So currently, as the certificate stands, we do not talk about simulation specifically, but if you're interested, I can try and provide some for you. There aren't that many out there. There's a few places that are doing it, and you know, Jefferson wants to be one of the first ones to do it, so I'm sure once we start regularly using it, we will start to train in that as well.
Great. And now I think we're having a few more about reimbursement and billing. So I just want to go through these. Do you know how reimbursement works for primary care, such as diabetes follow-up? And that was from Bob, class of 2004.
Perfect. So actually, I see the questions now. Most of them are low-level visits for telehealth, currently especially, so we at least don't bill at a higher level for such visits. I don't know exactly how the primary care works. It's different in Pennsylvania. I know that they are giving reimbursement based on a lower level like 99214, 91215.
Oh, great. And then let's see here. If a patient is referred to the emergency department post-telehealth, are the services expedited or fast-tracked in any way?
I guess it depends on every facility. For us, when I see somebody in telehealth, and through telehealth, and I say you should probably go to the ER, I actually give the ER a call because they're my colleagues, and I let them know this patient who's coming. The documentation is all the same, so they actually have access to my documentation, so they'll be able to see what I wrote as well. And based on that, they'll have an idea as to what the patient needs to do next. This doesn't mean that the patient gets to jump from the line because the ER is still the ER, but they have a lot more information and sort of a plan of what we were thinking when we sent them to the ER.
Great, and I think there's a follow-up to that. Karen Kramer, a 1981 diploma nurse grad, asks, can you talk about charting in the EMR in regard to a telehealth visit?
Yeah, so our charting is actually pretty straightforward. It's like any other visit that you would do, and we chart it in, currently as we switch to Epic, we chart it in Epic as a telehealth visit, and we perform or we complete all parts of that chart. So we do a past medical history, a current HPI, and then the extent of the physical exam that we can. For example, patient appears well, no acute distress, breathing, respirations are normal, there are no visible skin rashes, extraocular movements are intact, etc. And we do a full visit, and we do a full note for any telehealth visit that we perform. We can also prescribe medications after a visit. We can send them specific specialists that they need to see. So all of this gets documented, and at this time, the patients do get a copy of their chart so that they're able to see what we talked about.
Great. Let's see here. Does the certificate program offer a list of participants who have completed the program if someone would like to contact them to engage them as a provider or innovator?
So we do. Once you're a participant, we actually have a running list of past classes and past participants specifically for this reason, so that you get the opportunity to be able to collaborate with people close by or long distance or in the same ideas. And in fact, I've found that the people within the certificate program who are in your same cohort get to exchange a lot of ideas and learn a lot of things. So you do have access to that, yes.
Wonderful. Is there reciprocity with New Jersey for Jeff doctors licensed in Pennsylvania?
So I'm not sure what you mean by that, and I would ask for a follow-up. Let me answer the way that I think you're asking. Is that if you are licensed in Pennsylvania, can you practice telehealth in New Jersey? The answer, unfortunately, is no. So currently, I hold multiple licenses because I take patients from multiple states, and that's just the way that we have to do it. You have to be licensed in the state that your patient is physically situated. And let me know if I didn't answer that question.
All right, so I'll keep a lookout and see if he asks another question. Someone asked, how do you handle credentialing and privileging at the sites remote to Jefferson?
So if we are, so we need licenses and credentialing for any patients that are outside. If we are doing teleconsulting at other institutes or other locations, there's usually a agreement drawn up beforehand, and that expedites privileging and credentialing if something.
And it looks like the last question right now is, has there been any communication regarding Jefferson opening full-time facilitator positions in the near future?
It's a really great question. I don't know the answer to that, but I do know that currently there are about three facilitators, and they're looking for a couple more. I don't know when they're going to open up those positions. They may want part-time versus full-time, but we're still recruiting because we're not just looking for people at Jefferson. We're looking for people at ARIA, at Abington, at all these other sister sites that have become part of our network and that are also using telehealth.
Great, and it looks like there's no more questions. I just want to do a last call for questions and then remind everyone again that the webinar has been recorded, so we will email the link to everyone once it's been uploaded to YouTube. So again, if you have any questions, please feel free to ask them now. If not, I don't see anything coming in, but I just want to give everyone one more minute to collect their thoughts.
Of course.
Did you have any last-minute comments you wanted to say, Dr. Chandra?
Honestly, it's just a really, really great experience, and I'm happy to be able to talk to you about this. I have become a convert, really, so I hope that I've given you some experience and some information, and please reach out and let me know if I can give you some more. And thank you for joining us this evening.
Yeah, thank you. And Ingrid Hillman says, thank you, great presentation. So it seems to be everything. So I want to thank you again for presenting, and I want to thank everyone on for evening's webinar. Please let us know, alumni@jefferson.edu, if you have any other questions or if you wanted any more information about the telehealth programs. And thank you all for joining us.
Thank you.